Hello everyone, I'm Dr. Nishant, consultant neurophysician at OMNI hospitals. Today we are going to talk about the condition called epilepsy, remembering the 12th February this year for the International Epilepsy Day. So what is an epilepsy? Epilepsy is a condition where a patient gets fits, that is a seizure, at least more than 2 times, which is 24 hours apart, which are not triggered by any underlying problems. So if the patient has this condition and is labeled as epilepsy, what happens in epilepsy? Epilepsy, there will be a excessive firing of neurons in the brain cells, okay, and this continues as a chain reaction, especially in the some parts of the brain called medial temporal lobes, frontal lobes and occipital lobes, and that will act as a trigger for the clinical seizure. Coming to who are the people who can develop epilepsy. Usually the epilepsy is a condition which usually seen in the very early age, that is developing brain during the developmental phase of the childhood up to teenage, or else in the advanced stages of the advanced aging. So these are the extremes of ages where we can see more number of seizures or epilepsy, condition called epilepsy. So usual causes in the childhood or in a teenage are usually genetic causes, but otherwise if there is any insult to the developing brain, that can also cause seizures. Now in advanced aging also it is seen, because the brain starts to degenerate, and there is higher risk of and there must be other problems in the brain like stroke and knee tumors. So those age group people also are at risk of developing seizures. So other common causes of seizures in normal adult age group are strokes. That is when there is a damage to the brain because of decrease in the blood supply or any rupture of a blood vessel, or if there is any tumor in the brain, or if there is any infection in the brain, or if there is any demyelinating lesions in the brain, they can also cause seizures and develop into a condition called epilepsy. Epilepsy is more than 2 times of seizures which are unprovoked. That is called epilepsy. So now, what are the precautions one must take, or what one should do if somebody has witnessed a seizure? So if you witness a patient who is having a seizure, what you have to do is you have to make the patient lie down in the center, not in a corner, because that can cause injury to the patient, or not near any objects. Okay? And you have to roll the patient to his left side and give him some space and hold him, so that he will not aspirate and develop any complication called pneumonia, so that he will get adequate oxygenation during this episode. And we should give him an open air. Do not give him any keychain or any other objects that should not be placed in his hands, or that should not be kept inside his mouth to stop it. That should be avoided. Now if the seizure usually happens for 2 to 3 minutes of duration and it stops, and in next 10-15 minutes the patient will regain the consciousness. After that, you have to bring the patient to the hospital to see the doctor. If the seizure is not stopping within the 5 minutes of starting, then it is an emergency called status epilepticus, and it is a life-threatening condition. You have to bring him to the emergency immediately. Seizure, if it is not controlled, it can be life-threatening. If it is very well controlled, in most of the cases, like 85% of the 70 to 80% of the patients, it's very well controlled. They can have absolutely normal life. So because why I'm saying is because there is stigma around the condition called epilepsy, which we have to address, because they can have or lead a normal life in all their aspects, like professional, personal, without having any interferences if their seizures are very well controlled. And further, if any queries or any questions or any consultations regarding this condition, you can approach us. We have the facility for all these things to look after. Thank you.